Denver Public Schools has a lengthy plan to improve school safety in the district. It comes in response to the East High School shooting back in March.
Now, as detailed in this plan, school leaders across the district will be able to make decisions on their own if school resource officers are used. Now, this plan also calls for adding metal detectors in schools and focusing on mental health resources for students.
Tonight, we're following up on that last piece of that plan. Mental health concerns for students has been a big issue for several years now.
Now, the resources are just not there for adequate care. And Denver 7's Russell Haythorne has a look at how this plan could make things different.
In the wake of the March shooting at East High and several other high-profile cases of violence, Denver Public Schools rolling out a new safety plan which includes a heavy focus on mental health.
I think anything in getting mental health providers into schools in general is a step in the right direction.
Gabrielle Blickley at Health One's Behavioral Health and Wellness Center sees community partnerships as a key component to any school system's mental health strategy.
We will work with a school like, okay, you have a kid that's consistently suicidal, has self-harm urges, has maybe brought a knife or something to school. How do we work with the parents and the student, but then also the peers?
The DPS plan includes expanding the number of psychologists and social workers trained to work in schools, and also includes an emphasis on social emotional learning and bullying prevention programs.
It's encouraging that this is getting attention in a lot of places, including Denver. If people can understand these things and also accept mental health as part of their overall health, then I think we're going in the right direction.
Rob Bott studies mental health trends and says Colorado ranks near the bottom when it comes to treating mental health.
Colorado ranks 40th in the nation in overall access to mental health. 56% of people with a mental health issue are not receiving care. And then 34% of people who have a mental health issue have an unmet need.
DPS says it will be rolling out more information in the weeks ahead. Mental health professionals say now is the time.
That's where I think that school piece is really important, because parents turn to the school.
Sometimes people won't see a counselor or won't get help for a mental health issue just because of fear of some type of social stigma or being judged unfavorably.
I think there is a way to maybe not solve it, but help. You got to break that uncomfortability and have those tough conversations.
Russell Haythorne, Denver 7.
And if you'd like to, you can read all the specifics of the safety plan draft right now on Denver7.com. Also, Denver School Board Vice President Aonte Anderson released a lengthy statement in response to the draft. He says it's important for the district to listen to families of color as these conversations move forward. Anderson says we must prioritize the voices of marginalized communities, invest in mental health resources, and work with government partners to address the root causes of gun violence.
Anderson also called for a re-examination of the current policy related to pat-downs of certain students. He says a pat-down can be intrusive and distressing, especially for students of color. Tonight, we're following up, looking at new data detailing the number of pat-downs in DPS schools. As Denver 7 Chief Investigative Reporter Tony Kovaleski found, schools are not sharing these numbers with parents or district administrators.